Get ready to invest in yourself and elevate your expertise with the Perio School Podcast, brought to you by Perio School. It's Dr Reena here, and you're joining us for a new monthly show where we'll be providing the latest case studies, first-hand insights, and interviews with our global dental network. Plus, we'll enable you to experience exclusive behind-the-scenes highlights straight from our global portfolio of courses. Let's get started. This season of the Perio School Podcast is sponsored by Colgate. Register on Colgate's professional education hub to access all professional and patient resources, including your one-stop shop for all verifiable ECPD. Visit www.colgateprofessional.co.uk today to sign up and register. This is a short masterclass on essential steps for effective home care. So as we know, periodontitis, it's a multifactorial inflammatory disease associated with dysbiotic dental plaque biofilms. And optimal biofilm control through effective home care is literally the cornerstone of the prevention and treatment of this condition. It's the first, I would say, the most powerful step of therapy. If you look at the graphs in terms of how much improvement you get in someone's condition, the most dramatic improvement is during this phase. So we want to make sure we can guide behavior change. We want to make sure we can empower our patients and motivate them to be able to do this. But I get it, time is often limited in practice. So sometimes people want to spend hours and hours on oral hygiene, but we just don't have the time. You have probably a maximum of 10 minutes, maybe 5 minutes to give oral hygiene instructions. So I wanted to share my 5-step approach in terms of being able to provide effective oral hygiene instructions in the limited time given. Step 1 is orientate. So patients are generally unfamiliar with the oral anatomy and have an inadequate spatial sense. Like they have no idea where the gum is, they have no idea where the pocket is. So begin by actually just orientating them, introduce them to the basic anatomy, give them a mirror, get them to hold the mirror, you pull the lower lip back, use your probe, actually show them this is the gum, this is the tooth, this is the bit where the bugs get trapped. So actually put your probe under the gum so they can really visualize, this is why I need to angle my toothbrush bristles in this direction, so they understand it rather than, let's use a modified BAS 45 degrees. They may not understand that. Radiographs are great for orientation as well. You can actually show them, where the bone is. You can show them if there's calculus, show them the spaces that need to be cleaned, so they can really visualize what they're doing. Once they're orientated, things start to make sense. Step 2 is disclose. And again, I know we don't have that much time in practice, but even if you just disclose a small area, it can really highlight where the patient is missing. And it's great for patients who are convinced that their oral hygiene is immaculate and they don't need to use interdental brushes, because it will really give you that evidence that there is still plaque here, there's still areas that you can't reach with your normal brushing. It also allows us to give more tailored advice. So if you do disclose throughout the mouth and there's certain areas that keep showing that they're missing, then great, it gives you a good idea in terms of the advice you need to give to the patient. It also allows you to objectively give a score to the plaque. So you do a plaque score across the whole mouth and get a percentage, an actual number. Rather than saying oral hygiene is good, fair, poor, you've got a more objective measurements, because this good, fair, poor is very, very subjective. And then you use the score, and it gets very competitive in practice where, patients like, what was my score last time? What's the lowest score you've got, etc. So you can really give them some goals based on this score as well. Often my patients also like to take a photo of their disclosed mouth on their camera, so it gives them a good reference between appointments as well. Step 3 is demonstrate. So this is super, super important. And I think if you need to, set up a patient reminder on your system in terms of getting them to bring their oral hygiene aids with them as well, so you can really see how well they're using them. But I would always say get them to demonstrate first, and then go back and correct anything and adjust their technique as needed. I would definitely think about getting a test drive. You can get a test drive now for Oral-B, for Philips, all the different brands, and also show them in the mouth using a test drive. I think it's an important point, like an electric toothbrush is an investment. We can't expect our patients to invest in it without having tried it out. You wouldn't do that for a car, right? You've got to take it for a test drive first, and then you can buy it. So get them to test things out, especially those who haven't used an electric brush before. If they are struggling, because there's two types of patients. Some of them are they're not doing it because they're lazy, but some of them are physically struggling. And if they're struggling, it's our job to try and help them, and you've got to be creative. If they don't want to use an electric brush and they only want to use a manual, then can you get some putty and make a handle for them? Because it's often to do with grip. If it's manual dexterity, if patients with arthritis, etc. So you need to really be personalized in your care, but definitely use the test drive. Show them how to use the incidental brushes as well. The feel factor is really important as well. It's got to feel snug in between their teeth. So you need to help them, you need to size them up. And then I would say keep it simple, because I think sometimes we overwhelm them with lots of information, but actually even if they can just implement 1 or 2 things and then you build on that each time, then that will be helpful. Also keep it positive. I think sometimes patients come in, they leave feeling very deflated that they're not looking after their mouth, but I think you've got to keep it positive. And even if they are doing, cleaning a small area really well, bring that into conversation. Step 4 is reinforce the patient's responsibility. So I always say to the patient, it's 80% about what you do and 20% about what I do. That's why, firstly, I'm spending time on this, but you really want to take the ownership for your condition so we get the best results, both in the short and long term. So have that kind of conversation about reinforcing their responsibility. The final step is GPS, and GPS is an evidence-based approach of changing behavior. G stands for goal setting, P stands for planning, and S stands for self-monitoring. So G, goal. Today, we found your plot score was about 80%. Let's try and reduce that to 40%. That's your first goal. Planning, how are we going to do that? So we're going to do that by just focusing on your brushing technique that we went through today, and then we can review in a couple of weeks how you're doing. And then S for self-monitoring. I'm going to give you some of these plot disclosing tablets. Haven't had a chance to use them today, but I want you to go home, use them every week, carry out your usual home care regime, then use the tablet. And wherever you see the pinky purpley staining, go back, clean those areas. And you should notice over the time that there's less and less of this stained area, and it means you're getting better. Now, this last step in particular is extremely powerful, and I would say it's crucial, really, to treatment success, because unless someone knows how well they're doing, they will just lose motivation. It's a bit like, if you were trying to lose weight and you're going on a diet, but you didn't have a mirror, you looked the same, you didn't have a weighing scale, you didn't know how you were doing, your diet's not really going to last so well. You need that positive reinforcement. So this works really well. And I think once you've rehearsed it, once you've practiced it a few times, it can actually be done in just a couple of minutes, quite smoothly in practice. So to recap, step 1, orientate. Step 2, disclose. Step 3, demonstrate. Them first, then you. Step 4, reinforce the patient's responsibility. And step 5, GPS. End by setting some goals. I hope that helps, and let me know how you get on.
Hi everyone, this is Dr. Sophia from Perio School. Today is Saturday, 25th of October, and we are hosting Crown Lengthening Course. So at the moment, our delegates are placing their final sutures on pigs' heads, and it's just before we started live surgery. I wanted to go around and ask their feedback about the course, what they've learned today, what is the key takeaway that they will take back to their practice, and how they would describe this course. So let's hear what they say.
So yeah, the course has been really useful. We've learned how to suture, so it's going to help us in practice with oral surgery aspect as well. It's really well structured. Everything's written out in instructions and really helpful notes to go back and implement back into practice.
The theory part has been excellent, actually understanding how it works, why we do it and how we do it in certain situations, and also the practical aspect has been really handy as well.
You can hear that everyone is working hard, and you can hear Dr. Devin instructing our delegates.
Then I just scrub away this bit, and that's it.
So if you want to remove the bone in between the teeth, then you remove the bone. Then you remove the socket teeth.
So you just keep checking where you are, where the bone is. You've got 3 there. So it's not going to be tons of bone removal. Just do lateral one over, just section there. You can see this lateral, which I'll show you the radiographs afterwards. It was clear that there wasn't tons to remove. So actually that lateral, I don't really need to remove any. You've got that 3 millimeters already, if that makes sense. So what I'm going to do, I'm just going to work myself around. I might just slightly contour this bone a little bit because it's a bit bulky in certain areas, but it's very, very minor. Canines, again, not that much at all actually.
what you just heard is actually quite unique, because this is what's happening behind the scenes of the Crown Lengthening course. While Dr. Reena is performing a live surgery on a patient, Dr. Devon is staying with our delegates, helping them to improve their techniques and to tailor all the skills according to what they need to learn. So yeah, stay tuned, and if you want to learn how to do a crown lengthening technique, please sign up, and we have a next course in April 2026.
Today, I'm thrilled to be joined by someone I find genuinely fascinating. I met him at the FIGS Ambassador event and was immediately struck by his energy, curiosity, and fresh perspective. He's used to being in front of the camera, in the media spotlight, and always working at pace. It is, of course, Dr. Bolu Eso. Now, here's what makes him even more interesting. Dr. Bolu isn't a dentist, but a vet who practices dentistry on animals. After graduating with honours and a doctorate in veterinary medicine, alongside an intercalated Master of Science, he joined a veterinary practice in rural Kent. Bolu specialises in small animal medicine, has completed externships across the world, including the US, India, and the UK, and is now working towards specialising in surgery. So in this episode, we'll be diving into a mix of clinical case discussions and the reality of working as a vet, but also doing a bit of dentistry on animals as well. So welcome, Bolu. It's such a pleasure to have you on.
Thank you so much for having me. Whenever anybody reads off, like, I feel like in the UK, when you try and list the stuff you've done, you're always very like, oh, did I do all that? It sounds kind of weird. But yeah, thank you so much for having me. Can't wait to get talking about all this dentistry stuff.
Absolutely. You know, you should be super proud of everything you've done so far. So even though you've got a background in veterinary medicine, obviously when we spoke, and the reason why I got so interested is, you know, you practice dentistry on animals. Tell us how you kind of got into that, and I didn't even know it was like a proper thing. So yeah, to know like what sparked your interest.
So do you know what's funny? I think from the human medicine side, I think a lot of stuff in veterinary medicine is completely overlooked, despite us all being mammals, right? So there's all this, you know, we're all mammals, right? So we all generally suffer the same afflictions. The only difference is that with humans, we can communicate it a bit better, and we're just a bit more cognizant of the human experience, you know, like just because we can empathize with a human more than we can empathize with an animal or an insect or whatever it may be. Occasionally, depending on what kind of person you are, not judging anybody's personality traits, but so it's that kind of thing of, pets will go through dental disease the same way humans will go through. And I think there becomes a slight cognitive dissonance when people think about pets, because they think about wild animals and they think that wild animals are our pets, but they're so different. You know, we've come a long way by domestication to have pets become pets and that companionship that we have, right? And because of all those years of domestication, that years of slowly adapting them to our lifestyle, a lot of the things that they used to have, or the way they used to be so hardy and so bulletproof in the wild, they're not as hardy as bulletproof as we think they are now. So where people would think that, oh, tigers and lions go about dentists, why would my dog need a dentist? Well, your dog is eating carbohydrate-based foods, is eating a lot of more sweets and snacks, is eating a lot more regular than it is. Also, there's this thing, when I was on my dental course, we talk about, like, you know, the natural function of teeth, right? And how, like, if teeth, especially in animals, if teeth are used how they were evolved to be used, then they can be kept clean in a way. So, like, in that sense of, like, with carnivores, specifically carnivores, they have pointy teeth. That's the whole point of carnivores, right? Their teeth are pointy, and it's for grinding on bones and crunching bones. And that slicing and grinding motion is a way of keeping the teeth clean, because it's like the mechanical debridement of plaque, and they're doing it quite regularly. Whereas when we introduce to our lifestyle, and you're giving your cat like licky lick treats, and your dog is getting like little, it's not using it in the mechanical function it wants to. And so because of that, plaque, debris, tartar sits on there, and then it builds up, and then it turns into perio, and, you know, and then you get all these diseases and afflictions that we would get as humans. And the biggest thing is that people forget that with all the up care or the husbandry around their pets, they forget about the idea of brushing their teeth. It's something as simple as brushing their teeth, because you can brush them, you can look after them, you can take your dog for walks, you can pick up their poo, you can feed them, but are you brushing their teeth? And how regularly are you brushing their teeth? And, you know, are you looking after their oral biome per se? Because, like, we know from humans and all the studies from humans how much the oral biome has an effect on the whole body. It's the exact same thing in pets, you know. And there's still a lot more developing studies, but a lot of the things that we used to talk about, like things like endocarditis. I know what's interesting about human medicine is that it kind of, one year it kind of tells you that, oh yeah, there is increased risk, and then the other year is that, oh, it's not really that much of an increased risk, but then it is an increase, there is that risk, and then there is the link, and there isn't. And so like there's link between like diabetes and heart health, and even like the gut microbiome and other diseases and susceptibility of diseases. So there's all these conditions, and I always say that with veterinary medicine, maybe we're like 10 years behind when something gets brought to the forefront in human medicine. We're a little bit behind in veterinary. So it's just that kind of like, so I was just very inquisitive about all these things, like, and you can tell I've gone off such a massive tangent, but like, but like I was so inquisitive about this thing, especially going to school. When I went to school in Hungary, and there was a veterinary school, a dental school, and a medical school, and all of my close friends were like medics and dentists. I used to hang around with the medics and dentists, so I used to spend a lot of time talking with them about dentistry and medicine and human medicine. So I used to, even though I was learning my studies and so passionate about veterinary, I would go into like hear these guys talk about dentistry or hear their exams and be like, oh, what's that? And then slowly in my career, it started to seep into my veterinary career. And then I was like, well, everybody seems to neglect the mouth. Like, why aren't we looking at it more? And it's becoming more popular. It's becoming more popular in veterinary medicine as well. So it's one of those things where it's like we're at the cusp of it. I would love to do this stuff. I love surgery in general, and I'm very positive about this mouth thing. I've talked about it so much that, you know what, let me go and do my certificate. So I did like a certificate inside dentistry and oral surgery, and that's how I've got like this love for dentistry and pets.
Amazing. No, I love it. I've not met anyone like you, which I think it's a very unique. It should be more common, right? As you said. What kind of, so, I mean, when we were talking at the event and we were talking about, you know, and what you just said now, obviously all animals, they should be brushed, you know, your dog, your cat, you should be brushing their teeth. But as you said, we feed them, we take them for walks, so why are we not brushing their teeth? It's like, actually, that's such a good point. How many people, like roughly, like from the people you see percentage-wise, how many people are brushing their pets' teeth? Like, is it really rare? Is it fairly common? Or I'm interested.
I want to say it's not that common. I would say it's less than maybe, like, I don't want to, I feel like somebody said 99% of statistics are made up on the spot. So 2% of people, I would say like 2% of people are brushing their teeth.
So it's low. It's really low.
It's very low because often, especially, I mean, if I'm working in a dental place, then you're more likely to get the fastidious owners who are on it and they're brushing your dog's teeth.
Yes.
But in most places, there's so many, it's almost like Maslow's hierarchy of needs, but in pets. And it's like there's so many other afflictions that people are thinking of before they even think about the teeth. And the teeth are the last thing they come in. But I've got an 11-year-old that's come in and it's come in with like a tumor on its leg. But I'm like opening its mouth and I'm like, oh, have we ever thought that the dental disease might not help the fact that this dog isn't eating or that she's in pain? And what's hard about pets is that they just keep eating. They're so stoic because food is an instinctual mechanism of survival, right?
Yes.
So they're very instinctual about it. So because they're so instinctual about like eating, people are like, oh, well, she's still eating. There's no problem there. And I'm like, well, I've seen dogs hit by cars or had degloving injuries and they still go to eat the food. So it won't stop them. But the problem is that when they stop eating, now how bad is our dental disease must be so bad at that point if they've stopped eating, because they're able to habituate to the pain gradually over a long period of time. I think it's the same with humans. Like we slowly compensate for that pain and our threshold increases over a long period of time until it becomes so bad it's like, okay, no, this isn't bearable anymore. So I think the percentage is really low. And so often when I get those dental cases, I'm like, you know, if you start brushing now and you're brushing twice a day or you're brushing at least once daily, even if you brush 3 times a week, you're doing more than 90% of the owners that I see come into the practice, you know? So it is very low percentage of people that are actually brushing their dog's teeth.
But once you like speak to people about it, what's their perspective like? They're happy to get into that routine? Do you feel like it then makes a difference?
Yeah. So finances is a big motivator. Finance is always a big motivator because when you tell somebody that, oh, actually, like, I mean, a lot of time, a lot of these teeth are beyond like salvaging, like they're beyond repair at the stage they come in sometimes, because the perio is so severe. Like we're talking about like grade 4. If there was a grade 5, then, you know, it'd be like grade 5, like because the teeth are just hanging in by like pus and debris or like by hair and stuff. And it's just like these teeth have never been brushed. So a lot of time I'm like, okay, this dog needs a dental and we need to do multiple extractions. And if you quote somebody a dental, they're like, whoa, £1,000. I don't think it's going to be £1,000 to take out teeth. Well, obviously, pets aren't like humans where you can just sit in a chair and say, you have to completely knock them out of an aesthetic. You have to, and also we're talking about severe, like complex extractions. You know, I'm doing flaps and taking out teeth, and so you're doing serious surgery inside the mouth, and it's not a small procedure. But you quote somebody £1,000, they're like, whoa. And they're like, is there anything else I can do? And I'm like, well, if it's stage 4 perio, there's not much more you can do. But if we're talking about grade 1, grade 2, like very light gingivitis, mild bits of like inflammation around the gums and mild stomatitis and like different types of different type of afflictions, but that's a different story. You can brushing the teeth is the easiest thing you can do. And then people are like, okay, right, I'm going to get on it. I'm going to start brushing their teeth. And then they take it up. So there is that thing. And I think a lot of our job as medical professionals is education, right?
Yes.
And I think you probably have a hard time. Probably have a big deal of doing it with the mouth, and people. You see that people have patterns formed in their head. So it's kind of disarming that patterns and giving them the new information to be like, oh, well, actually, if you think about it this way, then you can understand why this is painful or why what we're doing is wrong. Let's approach it this way, and then we can. And so a lot of people, once they understand that, oh, actually, my dog actually does need its teeth brushed, they try and get onto it. So it does. People do have uptake as long as you take the time to explain why they need to do it.
Yeah. No, it's so interesting. I guess it's about almost treat the animals like how we would want to be treated as humans, and giving them those routines, and prevention is better than having to deal with the consequences of it. With humans, like perio gum disease is actually the most common disease of humans, most common chronic inflammatory condition. I'm guessing across the animals you see as well that gum disease is probably very common then that you see, or?
Yeah, so I say 1 in 3. So I'll say like, and this is just, and we're talking about like, so many afflictions with the mouth, right? And if we're talking about just specifically perio, 1 in 3 pets have periodontitis. So like, and if they're over the age of 2, or I think it's 1 in 3 pets over the age of 2 or 3 have periodontitis. So, and we're talking about like 85% of like the pet population will have periodontitis, and that's not even to mention like juvenile periodontitis or periodontitis caused by like supernumerary teeth, or like a congenital reason why they might have like all these other reasons why they might have perio versus just standard like just the fact they haven't been brushing their teeth, and their diet, things that we could just fix like as a secondary cause, versus like, okay, genetically this dog has an overcrowded mouth, or the teeth aren't in the right position, or we've got a mismatched bite, or all those different types of things.
With your so obviously, as you mentioned, sometimes it's gone too far and you have to do extractions. For the one-hand treat, is it the same techniques that we use in humans? Like you've got your scalers, and do you use ultrasonics, or is it hand scaling? Tell us more.
Yeah, so it's literally everything. Like, and the thing is that I think dentistry is a bit archaic in the veterinary world. I think as we've increased our standard of care across the board in so many other so many other like treatments, like we know how to treat hypothyroidism, we know how to treat diabetes, we're doing all these other things. Dentistry is starting to catch up because like, oh, we've neglected the mouth for so long. Old school vets used to do some horrific things in the mouth. They just used to stick an elevator, I'm not sure what kind of elevator it is, and try and take out a tooth, no flaps, no nothing, no whatever. But now we have very much like comprehensive procedures. We all know what we're doing. Like there's a lot. There is the British Small Animal Dentistry Association as well. So like we've got methods, and so for us, what we perform is a COHAP, which is a comprehensive oral health assessment and treatment. Right. So and then a lot of the time it'll be marketed to people as a scale and polish. So scale and polish is that you're just scaling and polishing. Some vets don't always polish as well. So that's another topic of discussion, because the biofilm inside the mouth of pets, like so. Within 48 hours, within 24 to 48 hours, that biofilm is coming back quite quickly. Okay. And if you're not brushing it, then there's really no point in doing a polish, because then all of a sudden you're like, oh, well, this biofilm is just going to come back as soon as we've done it off. Whereas if you are brushing it, okay, we can polish it. Okay. We still have that same discussion that you probably have in human medicine, where if you're polishing quite regularly, you're erasing like the enamel, so you're being quite abrasive with it. But we don't do it. We're not polishing that often in veterinary medicine. And then also there's the types of polish you're using: fine, coarse, medium. We have our process. So a lot of the time, a process from start to finish would be like, we have the pet in. The pet gets a full blood test usually beforehand. They go under an anesthetic. We knock them out. Then we're scaling. So we're using an ultrasonic scaler. We're scaling all the teeth, taking all the calculus off, taking whatever mass debris that we can take off. Yeah. And then we're doing oral X-rays. So we do like a full mouth survey, like take the oral X-rays. So this is like if we're talking about gold standard, take 4 oral X-rays. Then what I will do is I'll go around my dental chart. So I'll go my dental chart and have my probe. So I'll probe each teeth, both from the lingual, buccal aspect and medial side as well. And then just kind of go around each tooth. So you're going around each tooth and you're charting each tooth, and then you're assessing the level of bone loss. So indications for extraction, so like bone loss, gingivitis, calculus index. What else are we looking at?
Like the depth of the pockets and...
Yes, depth of the pockets, yeah.
Does that correlate with the same as humans? Like, or is there, it must be different numbers because the teeth are so long as well?
Yeah, so what's interesting is so depths are different dependent on species. So like there's a little Yorkshire Terrier here. His name's Nacho, and Nacho's teeth. If we were to probe Nacho's teeth, a sulcus depth from around 2 to 3 millimeters, I'm not too worried about, right? But if it's more than 3 millimeters, then I'm going to be a little bit worried in a tiny dog like Nacho. Then when we're talking about like something like a Great Dane, a big Great Dane, 3 millimeters over 3 millimeters isn't too much of a big pocket.
Okay.
But like 4 or 5 millimeters, then I'm like, this is becoming more of a pocket, you know. And then obviously you have like the pseudo pockets as well. So these are kind of indications for like that bone loss and that kind of exposure of the root, and like, you know, distinguishing the tooth anatomy is still the same, you know. So you know, you crown and you got your root and, you know, apical distal parts, and everything is still exactly the same. It's just you're just probing it, and so we'd probe it the same way, and that depth is just basically dependent on the size of the dog.
Yeah, makes sense.
But then it won't only just rely on the depth. So like, you know, with that depth, we might want to again check if there's a furcation exposure and what's the percentage of the furcation exposure. So I feel like you might not, in humans, it depends, probably not, but I don't think you'd get, well, you might do, you probably get some severe cases where you have furcation exposure. Whereas in veterinary, it's almost like every case is probably going to have some sort of furcation because teeth are so neglected. Whereas people probably don't let their teeth get that bad to get to furcation exposure. But yeah, exactly. I mean, I have a lot of dental friends, and I'm like, actually, as I'm saying this, I'm like, people do let their teeth get bad. So there is that. Yeah.
That's so detailed. I didn't realize it was like this. Is basically what I do for my patients. It's
It'll be exactly the same.
fantastic. I think it's definitely gold standard care. I think it's and I'm sure, you know, it makes such a big difference on the quality of life of that animal. And as you said, they can't talk, but they're, you know, you can tell when they feel better, they're eating better, the mood is better. I'm sure that has an effect on the, you know, the owner as well, and their happiness as well.
That used to be my immediate driver for doing dentistry. In fact, that's why I wanted to specialize in more, because I remember being a new grad and you get the cases that come in like a 7-year-old dog that's not really eating or painful in the mouth or dribbling. You do the dental, you take out like 1 or 2 teeth, 3 teeth, you close it up nicely. They eat as soon as they come off the anesthetic table. They eat, and you can see the difference even in the way they hold their face, because we've got stuff like in cats specifically, there's a grimace response. So that's like an indication of pain. So when cats are quite painful, they actually have quite a contoured face, and that's like quite a high grimace. And people might not notice it, but like when you're used to seeing it or when you can scale it, you're like, oh, okay. So then you start to see the grimace ease up. Amazing. After you've done the dentistry, or even if you've done local blocks. So like we'll do a lot of local blocks, so blocking the maxillary and mandibular nerve, especially when we're doing extractions. And you know, you see it like because that pain has gone away, and it gets even more fascinating. Like for me, a big thing I want to do is learn root canals and treating root canals. That's like more advanced dentistry, and I think that stuff gets even more amazing when you're doing it in pets, like root canals, tooth restoration, potentially implants and crowns. You know, all those little bits. So you know, I mean, restoration's a little bit easier. Then there's all the like the oral surgery stuff is what really drives me. You know, like I had a patient come in with cleft palate. So like cleft palates and like doing von Langenbeck methods to bring down the cleft palate together and all that sort of stuff. Really like that really it's enjoyable, you know, jaw fractures and how to like, you know, bring the jaw back together. Then, you know, cats get TMJ problems, a lot of TMJ problems. So they have to have like coronectomies of their TMJs and, you know, so all this fascinating stuff, like you're like, okay, this is cool stuff. And then oncology as well. So oncology in the mouth is really important as well. I don't know if it's the same in people, but like the way I remember it in veterinary medicine is foams. So foams is our top 5 tumors. So and not in any order, but if an order of foams: fibrosarcoma, osteosarcoma, acanthomatous ameloblastoma, malignant melanoma, and squamous cell carcinoma. So those are, and you know, the last 2 being like the worst that you can see in the mouth, like squamous cell and melanoma. Those ones are really aggressive in the mouth in pets. Especially in cats. So
there's so much there. It's just another whole world like of dentistry. I also wanted to talk to you. Thanks for sharing those cases and kind of the things you see. What is a typical day in the life? Because I know you do quite a lot of different things. Do you have a typical day set up, or is every day different?
Veterinary medicine is appealing because every day is different, and I think as vets we're very much like we have to do everything. right? So we are the dentist, we are the doctor, we are the surgeon, we are the anesthesiologist, we are the radiologist, we are the oncologist, we are the pediatrician, the list goes on. So you're very much pulled from pillar to post. And yes, you can specialize. And it also depends on what kind of team you're running in, how well staffed the practice is, what you're going through. Like I'm a locum, so I go from place to place. So I'm very good at like just thinking on my feet. And I love surgery, so I love doing just surgery in general, like whether it's soft tissue. I don't do orthopedics. Orthopedics is very unforgiving, and I do want to specialize in that sector, but I think I need to take more time out to. There's not enough of me to go around. But yeah, so like a typical day might be a mix of like you might have like 10 to 12 consults in the morning, and then go on to operations. So like have 4 or 5 operations in the afternoon, and then more consults in the evening. So it depends on where I'm working. Some practices like it when I come in, I just do surgery from morning till night. So like one practice I worked at, they used to love me coming in just doing dentals. So I come in and I do dentals from morning till night, and I'll have like, 5 or 6 dentals. But we're talking about dentals where there was one day I remember having like 2 or 3 lots of, I had like 6 extractions, 6 dentals, all of them were extractions. 2 or 3 of them were like full mouth extractions. So we're talking about like 40 odd teeth. And then you've got like the ones where you're taking out small teeth. So you're like taking out a carnassial, which is like a premolar, the 4th premolar. Or you're taking out like a canine here or there, and you're like, and by the end of it, my wrist is like, and I used to put a lot of stuff on my Instagram stories, like with all the teeth I've taken out, and my dental friends, even one of my friends who opened the practice was like, "Bolu, do you want a job? Do you want a job taking out the?" I was like, I wouldn't mind. I wouldn't
You'd
mind.
have no problem taking out human teeth.
It'd be good fun.
That sounds like quite a kind of intense, high pressure sort of style of day. What kind of keep your energy up? What keeps you, because you've got to be performing at your best the whole time. And then, of course, then you've got your media stuff. You do a lot of things on TV. How do you keep your energy high all the time?
Do you know what it is? Is that I think what's nice is that I've curated a life that I thoroughly enjoy, which is one thing. But 2, it does catch up with me sometimes. Like even now, like I had tonsillitis for the past 2 weeks, and it's knocked me, and I had to clear out my whole diary. I could barely speak, and I was out. And sometimes I think I'm superhuman. My mum's always telling me this, and she's always like, "Look, you like," because I'm so used. I have all the evidence of proof that I can do all this stuff. So I'm like, I do it, and I book out my days. And I'm like, okay, I've got work here, and I've got this meeting after work, and then I'll go to work this day, and then I've got to go and film over here on this day, and and I just book and book and book and book, and then before I know it, I'm like, oh, okay, I can't do this anymore, or I'll just get sick or whatever. I do keep my energy up just from like routines. I'm a creature of like things that make me happy. So like whether it's staying in the gym when I can, and like whether it's eating the fruit and taking the time to walk, or taking time to sleep, or catching up on my films, to spend time with my girlfriend, or whatever it may be. Like the things that make me happy, like they help fill up my cup.
Right.
Because there was a point where I was going so hard at work that I burnt out and I exhausted myself, and I was working for so long, and then I thought, like, what's the point of working if there's none of you left? So I have to work at a pace that suits me, and that's where locoming gave me that kind of freedom to kind of pick up work, drop it, have time for media, social media, TV stuff, and and then kind of get back into it and rest when I want to. And so yeah,
Makes sense. I think it's so easy to, when you really enjoy what you're doing as well, to get cooped up in it and then kind of almost overdo it. But yeah, trying to find that, it's always a difficult balance, but trying to find that kind of lifestyle balance is key, I think. You do a lot of stuff on TV as well. Like, tell us about that. Have you got any top tips on for our listeners who are doing media, how you kind of keep your calm and confidence? Any top tips on that? Because you're definitely natural.
Do you know what? The social media thing is just an extension of like my personality. Like it's very much, I try not to overthink it. And I think it's easy to overthink a lot of things that you're putting out. I think what helps us as medical professionals is that there's a lot of pressure being a medical professional in the first place. Like there's a lot of pressure in the consult room, thinking about your license, thinking about what you're saying, thinking about all those things. There's all that pressure. And I used to think about that very early on when I first started. When I graduated, I was like, oh, I'm the doctor now. Like people actually have to listen to what I say. That's crazy. I could say anything and then they'll just believe me. Like that's kind of weird. And it's that kind of level of trust. And so once you kind of know, but the thing is that people trust you because you spent the time and effort knowing what you know, and you're not talking garbage. You're actually talking stuff that you know. You're pulling knowledge from what you know. So there should be confidence in the fact that you should be able to, you can stand on what you're saying. So if I'm extending that to social media, it's very much a thing of like, well, I say this stuff in a consult room. Like if I'm doing stuff in a consult room. Like this is the stuff I do at work. Like if I'm going to talk about animals, Like, I know this stuff because I give this information to clients.
Yeah.
And if it's stuff about my life, well, that's my life. So it's just a general aspect of myself. I'm not going to give you a false perception of myself. I'm not going to lie to you about who I am, or if I'm cooking or if I'm going on holiday or whatever.
Yes.
This is just a reflection of what my life is like. So then I can be confident in it because I have the proof evidence that this is actual real stuff. Like, it's not, I'm not fake. I'm not lying to you. So then I can just be myself, if that makes sense.
Yeah.
So there is that. And I think a big thing is just trying not to sweat the small stuff. I think especially in this day and age, social media is so fast, but what you can use it like an experiment. It's so fast. So if you're failing at something, or if something doesn't do well, or it's not how you want it, it's okay. Like, digital lifespan is like so quick these days. Like, so you can just fail quickly, have so many iterations, and then you get better at it, right? You find what goes wrong, and then you do something better. And you tweak it, you adjust, you retry, and you go again. And I think being in medical school builds that kind of resilience for you, because you have so many failed attempts of doing stuff that you're like, you're comfortable failing and getting things wrong. That it's like, okay, well, I'll do this again. It's not that hard. It's not a big, and then you know that you can get better. It's like, I'm sure the first time you ever did any kind of oral surgery or anything, like, you're like, at the beginning it's like, oh, this is a bit sloppy, or my sutures aren't how I want it. And then after a while, you practice and you get better and get better and get better. So,
and I guess it's such a great way of kind of just educating the wider public, making it in your profession. And no, I completely agree. I think at the end of the day, you just want to be genuine, and it's an extension of your personality, as you said, and you're not saying anything that you're just saying what you already know, I think is the key thing. So, really good advice. My final question, I could talk to you forever, but my final question, like looking back on everything you've done so far, what would your kind of advice be to your younger self if you're kind of looking back and saying something a piece of advice, or someone, embarking on and want to do a similar career pathway, anything kind of spring to mind in terms of any advice you'd give to yourself?
Do you know what? When I used to work, and I still hold it to this day, when I used to work in my first job, I used to work crazy hours there, and I was studying so I could become accredited in America at the same time. So I'd like get up super early to go to the gym, to like go to work. So I'd get up at like 4 a.m. I still do that sort of thing. Like, go up 4 a.m., go to the gym, go to work for like 12 hours, get back home, and then study for like another 4 hours, and then just like literally use it all the day I could. And there was a point where my grandpa was staying over at my house at that time. I was living with my parents, and my grandpa was staying over. And he used to see me like just be out of the house the whole day. He's like, "You're coming back just now? Are you gonna go and read? Wow!" And then he'd tell me that over and over again. And then I'd come to the door and be tired. He said, "Another long day?" I said, "Yeah." And he said, "You know what? Hard work doesn't kill; it toughens." And he used to say that to me, and it's still in my head sometimes. I'm like, hard work doesn't kill. I mean, it doesn't kill; it toughens. I mean, sometimes it does catch up with me, but that is some of the things that I would love to keep. Of like, just kind of like, the reward does come. It does come in the end. I think another big thing is like, a big thing when I used to study for exams and have all this coursework, and so much stuff seemed so like insurmountable, I would like feel like, oh my God, like how can I do this? And my mum used to tell me, how do you eat an elephant? And I was like, what do you mean, how do you eat an elephant? She was like, just bite by bite. And I was like, oh, okay. It was just one foot in front of the other, bite by bite. Hard work doesn't kill, it toughens. Just keep going. And that's why Finding Nemo is my favorite film, because it's story. Just keep swimming. Just keep swimming. Just keep swimming, and you'll be all right. Don't think about anything else. Just keep swimming. Just keep swimming, and you'll be all right. So yeah.
Oh, well, Dr. Bolu, thank you so much for your time. I know you're so busy with everything, so we really appreciate it. What an inspiring conversation. And yeah, maybe we can collaborate on doing Perio on
No, we have to. We have to. Like, we must. I'm in front of, I feel like I'm in front of periodontology, like royalty. So I need to like soak up information.
We can bring that to your patients.
Yes, please.
Sure. But no, listen, thank you so much, and looking forward to seeing you again.
Likewise. Thank you so much for having me.
This season of the Perio School Podcast is sponsored by Colgate. Register on Colgate's professional education hub to access all professional and patient resources, including your one-stop shop for all verifiable ECPD. Visit www.colgateprofessional.co.uk today to sign up and register.